that Cameron finished his MPH and graduated just a few short weeks ago. And as a result of his project that he's going to tell you about, he is now working at DHEC, right? Started as a volunteer, progressed to a GA/residency, and now working there, right? All right. So I don't make that stuff up when I tell you that can happen. But I really wanted Cameron to come and share a little bit about his residency project, and in large part because when he was doing his residency presentation, he talked about how his community assessment class that he took a year ago really helped him. And so I thought maybe he would share a little bit about his project and a little bit about what he learned in this class and what he suggests that you learn in this class, so that you will be better prepared moving forward. But I want to thank Cameron for coming. Okay.
Well, good afternoon, everyone. Thank you for having me here today. As Dr. K mentioned, I just graduated a few weeks back, and now I'm employed for DHEC. I work in the Office of Community Health Improvement.
Okay, there. Oh, Janet, are we recording? Yes. Okay.
Yes. Oh, yes.
And when Dr. K says that networking is key, please do believe her, because that is the main reason I am in the position I'm in today. But just to talk to you a little bit about my residency project, it's called PESTT. What PESTT is a policy environmental systems tracking tool. That's what it stands for. And basically what it does is it focuses on a visualization component and a utilization component as well. So what I mean by that is, for visualization, what we do is we take a map of South Carolina, and it's divided into counties. It's at the county level. And what you can do is you can pull out your resources that you want to see, and you can plot them on the map. And also, the utilization component is huge in this aspect, because we not only want to have the data, we want other people to be able to use the data, not only ourselves, but community members as well. And PESTT serves two purposes. Basically, what it does is it links community members to the resources in their area, as well as helps public health professionals identify gaps in these communities so that they can implement policies and programs. So, for example, if a community said one of their top health concerns was diabetes, we would go in and look at that community and see if they have a national diabetes prevention program in that area. If they don't, we then know that that is an area where we can go and try and affect change and implement a program. So some things I want you to think about when you're dealing with data. So first thing is, what are you going to be using it for? It's very key that you know what exactly is going to be the outcome and what you need to do when you're using this data. So in PESTT case, what we want is, like I said, we want our community members to be able to go out and look at this data and be able to use it for their own good. Who will have access to it? So basically, who else is going to have their hands on it? You don't want too many people to have their hands on it, but not enough, and you'll be in the hole. So, because you don't want to mess up the integrity of your data. So having too many hands on it can make it a little messy, and you'll go in and maybe something's changed. So that's just something to think about when you're working with data. You don't want too many hands on it. And also, who's going to be using it? Of course, community members and public health professionals. Also, when will your data need to be updated? When was the last time it was updated? And who's going to be making these updates? Those are always important as well. Okay, and also, where would this data be housed? That is also important. You want to have it in a place where only the people who will be working in the data set can get their hands on it, but you don't you don't want it to be to where community members can't access it as well.
So let me just clarify that. So you want community members to be able to look at the data and see a visualization,
Yes, ma'am.
but not actually mess around in the
Not
data.
with the actual data.
Right.
So,
Okay.
I'll explain a little later. I'll show you all the actual website that we worked on for my residency project, and I'll actually walk you all through it. But so that's where community members will be able to go in and see the data, but they don't see the backside of what we're working in. And also, like I said earlier, you want to just make sure you maintain the integrity of your data. So you don't want too many hands on it. You want to make sure that you got the right stuff. You need accurate, up-to-date information if you're going to be disseminating out to community members. So just a little bit about my process from start to finish. So a few years back, PEST came. It was an idea. It came up at a meeting, and it was from the CTG grant. So basically, they decided they wanted a place where community members could access this data, as well as public health officials, and it would give the Bureau one place where all of them could go and access this data easily. So what we did was we identified what data sets we wanted to include in PEST. And then we had to go in and identify what needed to be included about each data set, if you get what I mean. So say we identified child fitting stations as one of our data sets. So then we needed to figure out what about each child fitting station we wanted to include. And I'll talk to you more about that a little later. So, and then you want to populate each data set. And then we wanted to make sure we had our maintenance functions squared away. So basically, when did it need to be updated and how often did it need to be updated? Again, the integrity of the data. And also, we wanted to make sure that it was sustainable. So we needed people in place to where it was easy for them to update the data, as well as making sure there was somebody who could actually, oh, okay.
See, it's distracting.
Yeah, somebody could actually be there to update the data. And then we developed the web application. So why was Pit Pest created? As I mentioned earlier, there was no central location for all the Bureau's information and resources. Creating PEST made it easier for everyone in the Bureau to be able to access this information without having to reach out to different people. So we pretty much did the legwork for them. Instead of them having to reach out to different departments to get this data, we did that work for them and we put it in one location so that it's easy to access. And another thing is for public health staff, like I said earlier, we want to be able to identify the gaps and then allocate the resources in these areas as necessary. So for community members, they lack the knowledge of resources and information in their area. So what PEST does is it creates awareness of the resources that they have in their areas. But not only that, but we're actually linking them to these resources. So there's pretty much no excuse. We're telling you that there are resources in your area, and we're letting you know where they're at. So I'm not sure if you all can see this slide. I'm going to scoot up so I can read them off to you. So what all we decided to include in PEST, well, it's in its infancy stages right now, so it's still being developed and we're still making changes. So, and I'm the only person at this point who is making these updates, so we had to keep the resources to a minimum. So the resources we decided to include were county health rankings, community health concerns, the top 3 leading causes of death, DHEC risk factors, Eat Smart Move More chapters, which is one of our partners, and tobacco policies, and this is local, statewide, and county level, and national diabetes prevention programs, diabetes self-management education programs, child fitting stations, fitness grams, wise woman providers, baby-friendly hospitals, and farmers markets. So as you can see, it's kind of a lot of resources, but it's enough for one person. But in the future, as PEST grows, we're also going to have to grow as well to make sure that we can make these updates, because in the future we do want to add more resources um, to PEST so that we're reaching all areas and we're not just settling. So this is a quick screenshot of our spreadsheet. So like I mentioned earlier, we had to figure out what we wanted to include about each resource. So this right here is a screenshot of our national diabetes prevention sites. So what you can see is we have the name of the organization. We have two address lines. One address line is for the actual street address, and the other address line is in case it's in a suite. We had to do that because of the templates that we were supplied by the IT department. It wasn't compatible if we had to just put them all into one address category, so we had to split them up. And we also decided to include the city, the county, zip code, and the contact information. That's important because we don't want to just give these people the resource. We want to be able to get them in touch with the resource, like I said earlier, so that there's really no issues. You know where to go, you know what who to call, and you know exactly where it's at. So next came figuring out how to update the system. So of course I read off all those resources earlier. Um, they vary from monthly. They vary from monthly to every 3 years. So
I don't know. Has a mind of its own.
so monthly, we have NDPP and DSME sites. Those are updated every month, and every 3 years we update community health assessment piece and PEST. So just to talk a little bit about community health assessment, because that is this class, and it is something that really helped me in my role at DHEC. So basically, what we do is, I don't know if you all know about MAP or, but we call it the CHI toolkit. So basically, what we do is, alongside with MAP, we disseminate a survey and out to the community, and they'll give us, you know, the top three health concerns, um, whether or not they have insurance, all of this good stuff. So basically, we'll get the results, and then we analyze them, and we'll put it into PEST. And I'll show you what that looks like a little later. But learning about community health assessment really was beneficial because I work with it every day, honestly. And coming in, I had no clue that I would be even working in community health, but it happened, and now I'm thankful. So, um, and then we made a data collection tab, and I'll have a screenshot of that as well that I'll pull up here in a second. And basically, what that is it tells us, gives us each resource, when it's updated, when's the last time it was updated, and the contact information for that resource. And then we have the update calendars. This right here was it was pretty messy because we didn't know when to update each of the resources, but we knew that the resources needed to be updated either monthly or yearly, but we didn't know how often we should update it in the system. So we made some calendars to help us out. We made a monthly calendar, a quarterly calendar, and a semi-annually calendar. And I have a couple of those as well. And then we were also supplied templates by the IT department at DHEC. And this made updating the system a little easier. It gave us a faster turnaround. So instead of it being a delay in the information, when we updated the system, it was automatically updated into the website. So community members got the most up-to-date information. So the template looked similar to our template. I meant to our spreadsheet. It just had a different couple of columns. So we would move it from our spreadsheet into the template, and then we notify the IT department, and they automatically put it into the website. And that made it a lot easier than us having to um, actually sit down with them and try and figure out how to actually put stuff into the system. So here's the data collection tab. As I said earlier, it has the resource here on the far left, and then whether or not it's internal, external, and what department it came from, and then the email or website in which we pulled the data, as well as the contact information for that goes alongside with the email. And then we have when it needs to be updated. So does it need to be updated annually, every 3 years, semi-annually, quarterly, or monthly? And this is pretty beneficial because there's so many resources that you can kind of get lost. And the spreadsheet is huge. So it's like you may think that you have to update it, but you don't really know. So this was used as a guide to, so that we knew. So all we had to do was go in and update it. And then we would switch the last two columns, which is last updated and next time to be updated. This, of course, is an old screenshot, so the dates are a little off, but you get the picture. It's really helpful. And we have it by quarter. If you look in the second to last column, we have a quarter, and then the next one, it needs to be updated on quarter 3. And then you also have monthly and annually. Those are less stressful because you don't have to update them as often. And here are the update calendars. So as you can see, the first one is a quarterly calendar update, and it has all of our resources listed out. They're color coded, so the ones that are in purple, they have to be updated monthly. The ones that are gray, those need to be updated quarterly, and green, those have to be updated yearly, and the what is it, pink, those have to be updated semi-annually. So we just try to do little things like that to help us out as far as making the updates for pests, because like I said earlier, it can become pretty it can engulf you, and if you don't have something to keep you in line, you'll definitely make mistakes. And like I said earlier, when you trying to get resources out to the community, you want to make sure that it's accurate and the most up-to-date information. So these are some things that I feel like you all, well, I don't know your career path. However, these bullet points is what helped me in my position today. So GIS mapping, which is Geographical Information Systems. So this is basically what my project is about. We put all the resources on a map for you so that it's easy to access, it's user-friendly, and pretty much anybody with internet access can use it. And then we have MAP, which we call the Chai Toolkit. This was also beneficial because, like I said earlier, I use it pretty much all the time. And if you don't know what MAP is, it's basically, well, I won't spoil it for you because I've talked to my boss and she's supposed to come here and talk about it, I believe. So basically, it's a
hear about it, and they've already gotten a little glimpse of it too.
Okay. So I don't have to explain it then.
Yeah.
And but it's just a six-step process in which you assess the community's needs and assess and yeah, the needs of the community. And also collaboration and partnerships. This is also important because you're going to be working with partners all the time, all the time. They know you, you know them, um, and also community assessment. This is also, you know, what you ought to be talking about. But there's so many different ways that you can assess the landscape of a community, so you don't. So basically, just take it and take it all in, because you never know if you're gonna need to use it. And it was pretty beneficial and instrumental in my success. So I'm going to give you all a quick walkthrough of my of the website. Oh, what we wanted to do is we wanted to make this website as easy, user friendly as possible. So what we did was you can go in and you can click on the county, and right off the bat, it'll pull up a county health snapshot. So basically, what this tells you is all of the community health assessment data. So we got the name of the county, its ranking, top three community health concerns, which the community members voice themselves, so they can see that. We've got the top three leading causes of death in that county. It's not letting me scroll down.
Yeah, there you go.
All right.
Teamwork.
And it also has the risk factors. So basically, what this is it shows the percentage of the population that is affected by each risk factor. And those risk factors include, of course, obesity, physical inactivity, diabetes, and smoking. So as you can see in Richland County, these are this is basically their community health assessment. If you want to see more from that, what you do is you go over here and you click on the far left side the layers, and you can pick out any of the resources from this list and plot it on the map. So let's just say you want to see all the smoke-free counties. It automatically pulls them up on the screen. But the neat thing about PEST is you don't have to limit yourself to just one resource at a time. So if you want to overlay more than one resource, all you have to do is go in and click them, and they'll plot on the map. And if you want to know more about each resource, you go and click on the point, click on the point.
It's weird that like it. Some of your stuff works, but not all of it.
There we go. All right. So you go and you click on the point, and it'll pull up the site name and everything that we had in our database. So it has the name, the address, where it's located, what's the city it's in, zip code, and a phone number. And you can do this for anywhere. And as you can see, I'm gonna click out of here. This gives us a good visual of what counties don't have national diabetes prevention programs. And it makes it easy for us to see that, putting it onto a map instead of going through looking at your data set and, you know, trying to sort it. All you have to do is go in here, you can click which resource, and it'll automatically plot them. And you can see where their gaps are. Like, let's say Kershaw. Uh, One of their community health concerns is obesity. Well, we could go in here and we could see if they have a farmer's market. There's two farmers markets in Kershaw County. and there's the gray ones are the ones that aren't open. They're out for the season. But this pretty much just gives us a good visual representation of each county, what they have to offer, the lack of resources in that area, and it just helps us visually, so we don't always have to look at data the same way. And that's something that a lot of public health professionals are beginning to talk about. They like the idea of GIS mapping because it's different. It's a new way to look at the data instead of in boring Excel sheets all the time. You could you could look at it on a map or in charts, and there's really uh, no limit to where GIS will be going in the future. This is just a very simple version. I've seen some more uh, what's the word? Technology enhanced.
Well,
Uh,
yeah, there's surveillance systems that will
mhm,
show you a
exactly.
cluster of cases and
Those are
things like
huge
that.
too right now.
Yeah,
So this
surveillance.
is pretty much the future of public health here, and it's giving us a better way to look at our data instead of the way we used to. So it's exciting. I really enjoy it. Um, and I hope you all enjoyed it as well. Um, if you do want to play around in the website, I'll be sure to give it to Dr. K and she could send it out to you all.
Well, they have, so we uploaded your slides, so can
Oh
they
yeah,
use the link from
they
the
can just use
slides?
the
So
link from the
they're
slides.
welcome. So this is available
Yes,
now
ma'am.
and they can go through. So for your projects, if you're working in South Carolina, or you're trying to identify a community, then this may be a great way to very quickly go through and see what some of the resources are. You'll be doing something much more in depth as far as looking at your county, but this can give you a quick peek at what's happening in your community or county if you are in South Carolina. Now, I don't know if other states have things like that.
I'm not sure. Um,
Well, they use the
Yeah, the
county health
county health
rankings.
rankings have some of this,
yeah.
but yeah.
But all of this data is available. You just have to know who to reach out to in
Yeah.
order to get your hands on it. Sometimes it can get messy. You know, sometimes people don't email you back or things of that nature. So um, it's best to just have it in one area where you don't have to worry about, you know, reaching out to someone. You could just go in and access it yourself. So that's the good thing about PEST, and we're excited about the direction it's headed in because it's made great strides since the beginning of time. So
Great. It's great. Um, One thing to take into consideration, though, when you use GIS mapping, like the county health rankings, and even this, is that you may be looking at a part of a county. There's generally an underserved part of every community or most communities that you may not get the details of that from just a county. So, I mean, Richland and Fairfield and Newberry are all ranked highly in the community health rankings, but they also all have pockets of disadvantaged folks. So this is a really helpful start, but it doesn't necessarily give the whole county picture. What you did, though, Cameron, is that's really showing you what the assets are.
yes,
Is
ma'am.
really,
And
really
there's
good.
always room for improvement. That's the exciting thing about GIS. Like this is just the beginning,
Yeah, yeah.
and it's going to get
Mm-hmm.
way more advanced in the future. Um,
It
it's
has
come a
already.
long
It's
way
been, yeah,
already, and with
it has.
technology these days, you could just never be too sure where it'll lead us. So um, yes, I understand what you're saying, and they will definitely we can definitely improve upon it in the future.
Well, this may not be something where you need to include that. I'm just kind of throwing it out there when people, if they're looking at a particular community, versus, I think most people are looking at whole counties, and you know, it's great. It's a great place to start, and but yeah, you can find, and CDC has data, but not at the county level even.
Yes, ma'am.